chiropractor in Westmont, Illinois, board certified orthopedist, and we're going to be talking about some core and abdominal progressions today.
Dr. Agorola from Dillon, Colorado. I'm going to be assisting Sean here. I'm a board certified neurologist, and we're going to talk about some of the differences between abdominals, core, give you some anatomy, go through some simple progressions so you're going to have a good idea of how to do this on your own. So one of the things we want to differentiate for everybody is there's a big difference between just strengthening your abdominals and also strengthening your core. Your core actually consists of a lot more than just your abdominal muscles. So we're going to emphasize some of the importance of that today. Other core muscles would include your glutes, your hams, your quads, and some of your back muscles in addition to just your abdomen. What a lot of people don't realize is the abdomen actually has 4 layers of muscle. The nice layer that we can see on the outside here that sticks up like a six-pack is the rectus abdominis. It looks really nice, but functionally doesn't provide nearly as much stiffness as the other 3 layers of the abdomen. Next layer of the abdomen that we're going to look at is going to be the external oblique. The external oblique fibers run from lateral to medial, very similar to as if you were to stick your hand inside of your pocket. These are going to attach in the midline here, as well as to the ribs in an area in the back called the thoracolumbar fascia in your pelvis, and they're going to help make the outer portions of the core. Sean?
The external oblique is really important because what it does is it attaches, as Ivo said, off of the lower rib cage and it attaches down into the pubic bone. So when you get both of them activating at the same time, they actually function in a V. So on exhalation or an abdominal type move or a sagittal plane straight forward flexion type maneuver, it will actually drop the ribs down and approximate the pelvis. This doesn't happen really well if you're doing some abdominal work or core progressions on a full inhalation with the ribs flared, because in some ways it can create a more rigid cylinder, but in some respects it makes the muscles stretch weak and slightly incompetent. The external oblique is really important to engage this muscle during crunch or abdominal type progressions, because on exhalation with that muscle contracting, it will drop the ribs, approximate a smaller core so you get more intra-abdominal pressure and a more rigid cylinder. The external oblique works very nicely with the internal oblique with rotation. Why don't you talk about the internal oblique for a minute, and then we'll show you a rotation component of the two as a pair.
The internal oblique is going to run basically at a 90-degree angle to the external oblique. Again, it's going to attach to midline, but the fibers run exactly opposite. This makes for an interesting pairing between the 2 sets of muscles, since they have similar attachments posteriorly, with the internal oblique wrapping all the way around and attaching to the mid portion of the spine in an area called the thoracolumbar fascia. And that's going to be part of our functional link between our upper and lower extremity that we'll talk about much later. But the internal oblique comes down and actually attaches to this layer, so when we tighten that particular layer, it actually helps to control the lumbar lordosis as well as create some degree of rigidity. The external oblique on one side works in conjunction with the internal oblique on the opposite side to cause rotation contralaterally and to the opposite side. It's important that we have these two actually working together, as well as helping and assisting in bringing the pelvis forward and backward and helping to control some of the lower back curve. Sean?
It's also really important in that, for example, if we have this fellow turn to the right just here, or to the left, excuse me, just here, keep your pelvis right there and turn this way. So just turn towards me, your torso this way, and turn your pelvis this way. So in this position here, he's in left rotation. So we have the left external oblique shortening, drawing the rib cage down and towards midline, and we have the internal oblique on this side shortening. So you have 2 muscles in 2 different directions driving the 2 in a direction of rotation with stability. One of the major problems in a lot of people, go back, is that there's an imbalance between these layers, the 4 layers we're talking about, rectus abdominis, the obliques, and the transverse abdominis, which is the deepest of the 4 layers, almost acts more like a girdle. These muscles also, when paired symmetrically, will allow you to keep the rib cage on top of the pelvis. When there's some weakness, you can get a shift, or a shift with rotation. You'll see this in some of your athletes and clients, because the shoulder may be higher, or you may see a sagittal plane or a frontal plane shift in your client from one way or the other. So quite frequently, it's good to look at the athlete from a straight on and look for shoulders are equally over the pelvis, but also look at them from the side and see if there's a rotational component as well, because an asymmetrical pairing of just these 4 oblique muscles can create an asymmetry. Driving strength or training on that asymmetry will drive a stronger core in an asymmetrical position and could lead to injury.